Hi, good morning, everyone. Thank you all for joining us. In this webinar, we want to present you how the MACSQuant Tyto is being used to overcome the challenges faced in a conventional droplet sorting by turning them into achievable and successful. I'm going to go over several slides, explain with lots of examples and several movies. My name is Galia Abraham, and I'm the Scientific Support Manager in Almog Diagnostic. Okay, so this webinar will consist of three main topics: the MACSQuant Tyto specifications, which includes the device features, its unique cartridge, and the sorting mechanism. Then we're going to dive into practical research applications received from customers, and the last topic will be the clinical uses and applications that are already running in the clinics. The Tyto cell sorter offers all advantages of a real benchtop instrument: a cell flow rate for up to 55,000 cells per second, and now even more. The lowest operating pressure, less than 3 psi, comparing to a conventional droplet cell sorter, which starts with 40 psi. Of course, it depends on the nozzle size. The device contains a cooling unit, which provides a temperature control range needed for all types of samples. And the last very important feature is that there is no sample-to-sample carryover, since the device doesn't consist of fluidics and tubing sets that must be sterilized. With regards to the optical bench, the MACSQuant Tyto comes with 3 lasers, as example, violet, blue, and red, with 8 fluorescent channels and 4 scatter channels, providing full experimental flexibility and the possibility of multi-parameter sorting. So, a question: why does a Tyto helps you to overcome so many challenges? It does because a successful sort is measured by cell viability, activity, and also functionality. These characters are based on how gentle the sort is. The Tyto performs sort in very, very low pressure that even enables you to resort your sample. The samples are sorted inside the cartridge, which enables full sterility with no sample-to-sample carryover. Regarding safety, the instrument is risk-free to the users when working with risky samples, and it also a risk-free for samples themselves. There is no need to disinfect the device itself. The Tyto cell sorter is the fastest sorter in the market as for today. It can sort up to 4 ml per 1 hour and up to a total of 20 million cells in the same time. And the last very important feature is the highly concentrated target samples that are achieved at the end of the sort. So now, the MACSQuant Tyto cartridge. This is where the miracle happened. It is full sterile. It has 3 hydrophobic filters and consists of 3 chambers. You can load between 100 microliters to 10 ml sample volume and a maximum of 50 million cells per 1 ml. The MACSQuant Tyto cartridge is the actual heart of the Tyto system. It has 3 chambers: an input chamber, the positive chamber, which is located in the middle, and the negative chamber. All chambers can be accessed from above through a lure lock using long pipette tips. Different from conventional droplet sorter, the MACSQuant Tyto has no fluidic path inside the instrument itself. In other words, the cells do not run through the instrument itself, but instead, prior to the sort, cells are loaded in the cartridge and remain in the cartridge also after the sort ended. Here you can see at the bottom the microchip, And here you can see a movie of the valve. In the cartridge, the sort depends on the microchip, includes a magnetic valve that enables the sorting of positive cells from all the rest of the cells in the sample. Now here is a movie that will explain the sorting principle step by step. As you can see, air from the device is entering the first filter and then flowing through a tunnel and passing a second filter, 0.1 micrometer, while entering the cartridge into the input chamber. The air gently presses the sample into the microchip. Inside the microchips, the cells are flowing and excited by all three lasers. The emission is collected, and when the target cell is observed, the magnetic valve is opened and the cell is entering the positive chamber. Immediately, the valve will be closed so that the rest of the cells are entering the non-sorted chamber. At the end of the source, cells are collected from the positive chamber, which is in the middle of the cartridge, without the need to centrifuge or concentrate your sample, so you won't lose cells. So, to summarize the first topic, I wish to point out the challenges that a conventional droplet sorters harbor. A conventional droplet-based cell sorting is a harsh sorting process for the cells, since it happens under high pressure. The pressure in the nozzle can go up to 70 psi, of course, depending on the nozzle size. Strong shear force are on the cells, and the cells do get decompressed and charged. Additionally, these systems are open, and this makes the process prone to contaminations and, of course, sample-to-sample carryover. Droplet sorters do process aerosols activity, especially in experimental setting where sterility is crucial, as an example, subsequent cell culture, or even for clinical setting. This is very problematic. Droplet sorters are therefore based in expensive and space-consuming aerosol management system, which is the safety cabinet. In comparison, whereas the MACSQuant Tyto consists of a microchip-based sorting, this is actually giving him many advantages to a conventional droplet sorter. The sorter in the MACSQuant is gentle to cells, very low pressure, accompanied by no decompression or charge, and very mild shear forces. It's also safe and sterile because all the sort is being in a closed and sterile cartridge, harbors any fluidics, no carryover, no contaminations, and no active production of aerosols for the sample itself or the operator. Now I'm going to show you several applications and results from customers. So here I'm going to begin with the general slide. This slide presents application list features. In example, immune cells population for cell therapy, stem cell related disease therapy, risk materials such as bacteria, viruses, and the newest hot application, which is now widely used, is the nuclei sorting for downstream NGS applications. The first and most abundant example is PBMC's subpopulation sequential sorting. In this example, 3 populations from PBMCs were sorted: first B cells, then T cells, and in the end, NK cells. After one sort, the negative sorted fraction is taken from the negative collection chamber and resort again to gain another cell population. Sequential sorting is possible with the Tyto MACSQuant because the cell sorting process is so gentle to cells. Here is another example of CAR T cell sorting, which is a classic example of CAR T production process. This presents a sort started with the 17 target CAR T cells in the sample and ended up to almost 100% purified cells, which is the most important goal in the need for clinical settings. NK cells are also rare in human blood, and it is challenging to sort specific subsets. With the MACSQuant Tyto, it is possible to sort two major NK subtypes, the CD16- CD56 high, and also the CD16 positive CD56 dim, from PBMCs with high cell viabilities, providing full flexibility and functional assays afterwards. This is an example of sorting neutrophils that are extremely fragile. They react to any kind of chemical or mechanical stress. First, leukocytes were gated via CD35, then debris was gated out, followed by the sort gate set on CD16 positive CD45 low cells. The purity, as you can see, of the neutrophils was above 98%. This is an example of a double sort with the Tyto. The researchers wanted to test the suppressive impact of CCR8 positive regulatory T cells on cytotoxic T cells function in human lung cancer. Since tumor infiltrating lymphocytes are considered rare population in tumors and also hard to sort using a droplet sorted because of the long sort time and the poor viability, the customer turned to use the Tyto to overcome this obstacle. This is another example of performing two sorts. The first one was a bulk sort, while the second one is for the high purity. The findings presents the immunosuppression effect of the CCR8 positive Tregs and the potential value that these cells for therapy for cancer treatment. Another example of gentle sorting is the rare cell mesenchymal stem cells. These results were obtained from a biotech company in Ireland, which is now preparing samples for a clinical trial. Those samples are taken from bone marrow. They have performed a two-step sort, a first bulk sort and the second purity sort. They have received purities above 98% and positive CFU assays. Here you can see that at the end of the sort, a colonogenic potential of the Tyto sorted cells was analyzed using a colony-forming unit fibroblast assay. The efficiency of the cells after 14 days was 45%. The CFU efficiency is important because it's employed of the quality assessment of those gentle cells. Additionally, they also used the mesenchymal stem cell phenotyping kit to prove the identity of the sorted cells. As you can see at the bottom in the plots, the cells were positive to all three MSC's markers and negative to the immune one. The assays confirmed that the Tyto sorted mesenchymal stem cell fulfilled the minimal criteria for defining mesenchymal stem cells for clinical. This is another example for sorting of iPS cells with preserved functionality. Here, GFP positive pluripotent stem cells were sorted using the Tyto cell sorter, then replated and cultured for 24 hours. When compared to controls, the GFP positive cells showed comparable replating efficiencies, highlighting the gentle nature of sorting, which makes it suitable for these cells. Here, these are published results in the field of human pluripotent stem cell-derived cardiomyocyte. The aim of the researchers was to establish a fast and high-efficient generation of pure pluripotent stem cells-derived cardiomyocyte. By using the Tyto, the researchers have established a new workflow ranging from control cardiac differentiation to harvesting, purification using the Tyto MACSQuant, analyze, replating, and in the end, freezing these cells. This slide tells the story that has occurred in a neurobiology lab in Germany. The lab is investigating different types of medium spiny neurons and their signaling in Parkinson's disease. The sort of those cells for different types to be able to analyze the effect of dopamine on the BDNF signaling. In order to analyze the specific effect of these cells, they need to have 80% purity. Without sorting, they were not able to detect the targeted receptors. They started using a conventional droplet cell sorter, but neurons are especially sensitive to charge and plate voltage that interferes with their way of communication. Also, pressure and timing from the dissection to the plating and also the temperature are very crucial factors. As a consequence, after the conventional sort, these cells died in culture. It was after a hard year of working that they decided to try the MACSQuant Tyto cell sorter. As for today, their cells are being sorted on the Tyto. As you can see, they look much healthier and surviving well in culture. In the picture, you can see presented results of 7 days in culture. Here, I'm going to show you 2 slides, examples of sorting of risk materials. The first slide shows enrichment after sorting of GFP positive E. coli from a mixed population. In most cases, this sample had to be sorted on a droplet sorted in the core facility of an academic institute, where the device is shared with a lot of other users and therefore require intensive cleaning afterwards. Here, you can see another example of a risk material. This time, those are yeast samples. Also was easily and safely for sorting without any additional cleaning prior or after the sorting or exchanging any tubing set. The last slide in this topic is research, as you can see, the NGS application. The NGS application needs to minimizing the presence of nuclear aggregates, dead cells, cellular debris, cytoplasmic nucleic acid, and potential inhibitors of reverse transcription is crucial to obtaining high-quality data. Also, at the end, a concentrated sample of nuclei that here in the Tyto are received 1,000 nuclei per 1 microliter. This perfectly suits the NGS requirements. The marker in this slide is confidential because this work has been done by a collaboration partner. The origin sample was neuronal cells. So now we have arrived to the last section, the clinical uses and application of the MACSQuant Tyto. There is a high demand and motivation to discover and develop innovative cellular therapies, and for today, there are many challenges with the current droplet sorters that were problematically and actually predominantly designed for research applications and performs as an open systems, includes tubing sets, fluidics, and harsh sorting conditions. The MACSQuant Tyto cell sorter in the clinics. Sorting is happened fully closed and sterile cartridge, as I shown you the cartridge previously. No fluidics inside the instruments. All consumables are available as GMP. Currently approved the Tyto use in 15 different clinical trials, phase 1 and 2. More than 200 patient samples were already sorted until today, and more than 50 patients infusion provided. Here, as mentioned, all consumables, antibodies, cartridges, and buffers are GMP compliant with all needed documentations. Everything that touching the cells is GMP compliant. Since 2016, the MACSQuant Tyto has been used in clinical trials. To date, the Tyto is used for 21 preclinical and 15 clinical trials all around the globe. The sorted cells and applications are very diverse and range from immune cells to stem cells and also progenitors to develop therapies in cancer, autoimmune disease, and transplantations. There are also applications in eye degenerative disease and retinal progenitor cells that are being sought. MD Anderson was the first institution to use the MACSQuant Tyto in 2017 to sort antigen-specific MART1 T cells that afterwards were enriched and infused to patients. A year after the first trial, MD Anderson has performed 6 more patient sorts. The results shows very good purities and also good sort yields. The cell yield were almost 80 billion MART1 specific CD8 T cells. The important thing is that after the sort, it was possible to successfully expand these cells without any antibiotics. In Montreal, scientists are working on an exchanging workflow to treat solid tumor patients. This study is in the preclinical stage and focuses on melanoma. They started with dissecting the tumor from patient on the GentleMax system, then perform a density gradient centrifugation to enrich the tumor cells and get rid of debris and erythrocyte. After this, they stained for a panel of CD3, PD1, CD14, and CD45, and performed the cell sorting for PD1 positive cells. After sorting, cells get expanded and infused back to patients. This is the same clinical workflow to treat solid tumor patients. This one is performed in Barcelona and has been established a year ago. The only difference in this workflow from the previous slide is that instead of performing a density gradient enrichment, here a molecular analysis of PD1 expressing immune cells is performed just before the sort. Here is another example for a clinical approved protocol for antigen-specific EBV-associated NK and T-cell lymphoma. After the amplification of peptide-specific CD8 positive cells are sorting, and this is performing on the MACSQuant Tyto with an anti-41BB monoclonal antibody. After sorting, a mass production of the sorted cells is performed, and at the end, an infusion to the patient of the cells. This is an example of a familiar and established workflow for CAR-T modified CD8 T cells. This protocol has been performed in the NIH Institute. In the CAR-T cell production workflow, the MACSQuant Tyto can be used in several steps, such as enrichment of the CAR-positive cells after expansion for functional in vitro and in vivo analysis, enrichment of defined starting cell population, such as T-cell subsets, and for the enrichment of CAR-T after co-culture assays for omic analysis, as an example, genome, proteome, etc. This is an example of cell therapy for ovarian solid cancer tumor. This is in phase 1. A tissue is taken from a cancer patient as well as leukapheresis to get access to tumor-specific T cells. The tumor tissue is subjected to biomarker profiling to find targets on the tumor cell's surface that are specific for this tumor. These targets will be targeted afterwards by the T cells. Up to 4 tumor targets are selected from the screen. From the leukapheresis T cells are obtained, enriched on the MACSQuant Tyto, and then expanded. The patients get the lymphodepletion along with the tumor-specific T cells with low doses of IL-2 as an injection. Now, in the last 2 slides, I'm going to show you a very exciting story that is going on at Kira Institute in Kyoto. The first of its kind, thanks to the Nobel Prize winner. The main obstacle in developing a therapy for Parkinson's disease based immunopluripotent stem cells derived cells was to sort corine positive cells. This shows what a crucial milestone and a critical one in sorting procedure in this study. Let's take a closer look at the workflow of the scientists at Kira Center. First, they established a cell line. Then they expand the cells, perform neural induction, and then sort the cells according to the corine antigen on the MACSQuant Tyto. After this, they performed a post-sort differentiation and the formulation of the final cell product. The last step was the transplantation into the patient, and it already has been done. It is important to note that this study was started using a droplet sorter, but they were facing issues with cell viability, and also the hands-on time was quite massive. It takes up to 16 hours at the sorter. This is why they have decided to turn and to shift to go and work with the MACSQuant Tyto sorter. Hope you have enjoyed the webinar. Thank you all for listening. If you have any question, I will be more than happy to answer. Hi, I see a question for more. Does it do a single cell sorting? Yeah, it does. And yes, it's impossible to arrange a demo, of course. Okay, thank you all. If you want, you can contact us via email or just call us, and we will be more than happy to apply it with more information and schedule a demo. Have a nice